next speaker, Sheng Ge, is a director of strategic development at WeiMai, which is a multifaceted online healthcare service platform. So I'm really excited for him to share with you his insights on digital health innovation across China. Sheng Ge?
Hi, thank you, Matt. Hi, everyone. My name is Shen. I'm the Director of Strategic Development at WeiMai Technology. We are a managed care organization in China. Today, I'll give you a brief introduction about how we innovate in China's digital health market, and hopefully you guys can have some hint through the presentation. Before I get into the details of what our company do, I want to give you guys a overview of a typical day in a Class A public hospital. I don't know how many of you have actually been into a hospital in China, but you know, we are in the medical industry. You have to put yourself into the real situation. So this is a patient journey in a Class A hospital. Everyone gets an appointment registration before they can actually see the doctor through two ways. One, he or she holds a citizen card and go to the hospital. There's a machine, you can swipe the card, you can get an appointment either today or within a week. Second way is you go to the hospital's homepage online. Nowadays, a lot of hospitals do have that online registration, so you can get a appointment within a week. And then after you get the appointment, you are being led to different department. You wait in the line, you see the doctor, but oftentimes the doctor, you actually pick the doctor yourself without knowing who are good at which disease or which treatment. So most of the cases, the patient are managing the whole process for themselves. Starting from here, the doctor usually will give the patient an inspection. So he go to the inspection room, do the check, go back to the doctor and do the diagnosis. Oftentimes he will be offered with some medication. So he pay the bill, go to the dispensary, take the medicine and go home. So that's a actual process of a patient journey. And let's see how many people go to a hospital on a daily basis. For example, in Hangzhou, where Ben and I are based, a typical Class A hospital receives 10,000 people daily. That's a very big number. Consists of mostly two parts. 40% of them are first-time comers, and 60% of them are return visits. And in those return visits, they consist of three main groups. The first one is the people came here to renew the prescription so they can get the medicine for the next few weeks. And another 1/3 is the return inspection. So they return the hospital to do another check to make sure they're on the right track of recovery. And the other third is the appointment consultations. They either have a new issue, they want to see a doctor, or they feel they're getting better, so they want to make sure they actually do. However, in China's medical system, especially in those public hospitals, we lack of a role called medical assistant, which a lot of the UK or US hospitals do have. So in China's hospital, you can actually buy a lot of good medication. You can buy good doctor service, good doctor treatment, or you can buy good surgery, but you don't have any service. Everything you are managing your whole process by yourself. That's actually where WeiMai come in. We provide infrastructure, internet infrastructure for the hospital, for the doctors. Also, we provide we call medical assistant, which are based in the hospital to serve the patients when they purchase our service. Therefore, I'll give you an example of how we change the scenario of the hospital and all the patients. The first group of the return visits, we call them new prescriptions. they don't actually have to go through the whole process of appointment, seeing a doctor and get medicine. They can actually tap in our app and connect with their doctor to get an online prescription. And our MA will take the drug from the dispensary and mail it to their home. So these 2,000 people don't actually have to come to the hospital and waste half of their life. And the second part is the return inspection. These people have to go to the hospital, but with our service, they can get a direct inspection order, and they can actually go to the inspection room, do the check, and they can go home. His doctor will have their report ready online, and either through a text messaging or through a video chat, and tell the patients their situation. So these people don't have to waste 2 hours waiting in the line. They can actually go to the inspection room in a very efficient way. At least the consulting group of people. These people have to go through the process, but our appointment registration system can make sure that they are actually seeing the doctor, which they already seen last time, to give him a more personalized service and personalized care. Before WeiMai, there's no such thing in China called managed care service. We actually invented this word. We call this service level agreement. Our goal is to transform the homogenized service in hospital into a multi-level and diversified service. Our service mainly consists of 3 levels. The first level we call this is basic management. These management are oftentimes one time. For example, we can book the doctor's appointment, we can do a inspection arrangement, or we can have a online consultation for the patient. Oftentimes these are charged by times. And the second level is case management, or we call this whole course disease management. These kind of service consists of the doctor team, the nurse team. We call this a MDT. Also, we consist of our medical assistant and our AI process information system. Through this kind of service, we are actually managing the disease, the course of the disease. Either it's 1 month, 3 months, or even a year. During which we will arrange everything the patient needs in the hospital, and we will have our online service, including healthcare education, including recovery guidance, and health condition follow-up calls. And the third level we have is the membership management, in which our high-end customers will have a designated team to manage their health records. We'll have their family doctor arranged. We'll have a lot of the personalized service in our membership management. These are some of our screenshots of our app and our managed care tools. The first one is our homepage, on which you can find online consulting, you can find disease management, you can find prescription, everything you need is here. And the second page is the hospital homepage we built together with certain hospitals, and on which the patient can actually make appointment for every doctor who are working in the hospital. They can check their reports because our system is connected with hospitals information system. You can pay the bill, you can pay your bill online, and you can check the fee you spend in this hospital. Also, you can find every service available in this hospital, which turning to the third page. These are all the services we create with hospital. And because China is too big, every hospital in every province have their way of dealing with patients. So our service, we can say 70% of them are standardized, and 30% of them we have to adjust according to different hospitals' needs. These two screenshots are how the patients are consulting with the doctor online, and how are we sending them healthcare education information through our app. This is a health education after a knee surgery. Moreover, we have a localized service operation team we put in those hospitals. After we sign a contract with hospital, we will hire a group of trained employees, and with uniforms and with standard service, and we provide mainly three target roles for the hospital. First of all, we do maintenance. We install our network and our internet service. We do all the tech and product upgrade, and we maintain the system to keep all, for example, all doctors are online, and we help them to register. And Ben just said that we have 94% of doctor penetration rate, and we did a lot of work for the past 5 years. And also we play the role of marketing, because we want the patient to know that this hospital have this kind of service available. So either the hospital will give us a room or a counter or some form of marketing area that we can do either direct marketing, online marketing, or we held a lot of the events to let patients know. Also, our MA team are on the ground to serve the patient need, but oftentimes we are manage their needs rather than they have a need and come to us. So through this kind of service, we can help the hospital running more efficiently. We can allocate medical resource more properly, and our patients are more happy with the experience when they're in hospital. That's how we create value. Through our managed care service, you can see the contrast for the hospital without WeiMai service and with WeiMai service. We turn a hospital-based model into a hospital plus home-based model. We turn the offline-only service into an online plus offline service. And we turn the single-time visits into a periodically managed course management. We turn the random method of seeing doctor to a customized experience. And we turn the traditional labor-intensive way to manage patients into a AI plus MA plus MDT, a more intelligent model. Right now, we are covering a lot of the hospital departments, including pediatrics, obstetrics, cardio, rehabilitation, oncology, as well as health examination center, reproduction center. And we can find a pattern that if the disease occurs frequently, or a patient have to come back to the hospital multiple times, these diseases are what we are focusing at. And these diseases are more oftentimes more hard to manage by the patient themselves, or they cost much than the one-time kind of disease. So the patient can buy our service, have us to manage the recovery pattern for them. For the past 7 years, we have covered 280 cities in 30 different provinces in China. Right now, we are partnering with over 2,500 hospitals. Right now, we have over 60 million registered users, and in a lot of the cities, our user penetration rate is over 40%. At this moment, there are 200,000 registered doctors on our platform, and over 70 of them are doctors from grade 8 tertiary hospitals, and 40% of them have senior titles. And what we do is very down-to-earth business, so we are serving people every day, and not only the patients are happy, but also they send us a lot of the thank you letter and thank you flag. We're very proud of that. So every presentation, we just want to share how many flags we receive and how thankful our patients recovered properly and enjoyed a good experience in the hospitals. And Ben and Matt asked me to give some tips for a Sino-UK collaboration. I'll just mention 3 points on top of my head. First of all is you have to read every policy that the government issues. That's the #1 rule for doing business, especially in the medical industry in China. And also because we are a very large country, the national policy are adjusted through different provinces. You have to read the national policy as well as, in every province, even in every cities, the policy might change in certain ways, and you have to deal with that. But that's not a burden. That's actually an opportunity, because some of the provinces, such as Hainan, Zhejiang, Shanghai, are more I won't say advanced, but more open to new technologies and new business. So sometimes getting to those areas are better to kick off. And a lot of people say find partners, but I want to mention that finding the right partners are key to success. Right now, China has passed the business environment that someone had, hey, I have connections, I have resources, we can do business here. I think that can success in maybe 10 or 20 years ago, but right now it's more of the technology background, more for the operational capability, more for the actually who can actually serve their clients better. So right now, finding the right partners, but not those looking good partners, are very important. And lastly, I want to point out that you have to get a WeChat. That's the #1 communication tool in China. Without WeChat, you can't connect with anyone. We don't actually check email often. That's an outdated way. You need an hour for the receiver to respond you. We just work too hard, and you send me a WeChat message, I will reply you in a minute. With that being said, thank you very much. And we are based in Hangzhou. This is my WeChat QR code. If you have WeChat, please scan me, add me. If you don't, save the screenshot and add me later. We're looking for partners with, if you want to go to a hospital to provide any kind of medicine or any technology, or you are a DTX company or a telemedicine company, you want to get into the customer business, you want to get to know the customer directly, you can find us as a partner to start with. And thank you. That's my presentation, and let's open up the floor for questions.
Thanks, Sheng. Really nice. And I just like to say personally, I really like the flags. I think it's nice getting to see when healthcare is actually being used for really beneficial stuff. So really lovely, and thank you for sharing. For questions, I got a couple here. I think the first one, which I like a lot, is how do you select what components the platform needs? Do you try a large number and only a few become successful and stay, or is it customer surveys? How do you decide?
You mean how our platform are formed?
Yeah, exactly.
It's through a lot of the, we call it micro innovation, because before 2018, China doesn't actually have a policy that supports internet plus medication plus healthcare or medicine. Before that, we actually did a lot of trials. We want to work with a lot of the hospitals, but more oftentimes the hospital said, "Okay, I will buy your software, but we will operate by ourselves." That's actually a bad way to start internet hospital, because the key to success is operation, not a software. No one will use that if there's no operation. So we are convincing every hospital we actually give them the infrastructure, the internet infrastructure for free. And we help them to run it, to actually use it. And through the usage of our platform, we find the way we can actually innovate. And then in 2018, China issued a policy that supports internet medication and internet plus hospital. And then a lot of hospitals actually coming to us say, okay, now it's the time. So every small step you can see our platform are through a lot of the failure, a lot of mistakes, and we spend a lot of money in developing every kind of tool. Some of them are useful, some of them are not. But one key is that because we are serving the patients and patients are paying us. So if the tool or if the service are useful, are meaningful for them, they will actually pay. If not, that's a false function or a false need. So we have to think of who are the final payer and who are we actually serving to.
Interesting. So at this point, would you say that the hospitals are more difficult to onboard, or do you have more trouble with the patients, or is everyone happy to work with you now?
I would say the latter one, because we're actually helping the hospital to run more efficiently. If you can remember the first slide I put up on, we have 4,000 of people. They don't actually have to come to the hospital, but they are actually purchasing certain service or medicine from the hospital. And we save them 4,000 people time, so they can have 4,000 new patients to serve with. So the hospital are actually very happy. And also the patients are happy because they don't have to waste time. And they can spend a little bit of money to buy our service, and we help them run everything for them. But of course, there are people, they don't buy our service, they go to the usual process, that's okay. So that's what we call a multi-level and diversified service.
Nice. Well, sounds like you're doing well on all fronts, and exciting to hear that. So thank you for sharing. Real delighted that you could join us today.
Thank you, Matt.
Lovely.